Hello, welcome back. I'm Dr. Oscar Hernandez, board-certified internist and pediatrician. We've been running a series on COVID-19 infection, and we just finished very recently a series that has to do with questions that my patients often ask me here in the office. Now, today I'm going to talk about the importance of antibody testing. On the last program, we talked a little bit about the tests that could be done in a patient who is sick, who isn't feeling well, who shows signs of active infection. And those tests right now, as they are tests that use something we call polymerase chain reaction ELISA technology. And if you remember from the previous video, these are the tests that you can do by doing a nasopharyngeal swab, where you take a long cotton piece applicator, put it to the very back of the throat. This is what we do here in the office for patients who are currently sick. And there are also some at-home tests that are now being marketed, one by Vault Health, which is the saliva test, where you spit into a cup under telemedicine supervision from a physician or a healthcare provider, and another one that is called the Pixel test, and this one is being offered by LabCorp, and this is a test where people will rub the front of their nose. This is something they can do themselves, putting a device all the way back into the back of the throat. Most people won't do, but the Pixel test just uses a front device, and you send that off, and you get a report. So polymerase chain reaction tests are the ones that we try to use on patients who look like they're actively sick, and they basically measure if you have virus or not. So antibody tests are different. And antibody tests we generally do in people who have overcome an infection, or we think we overcame the infection, to see if they've been exposed to the virus. Now, here's the proviso. That's true for IgG testing, and IgG goes up between day 7 and 20 of an infection. Some people do not produce an immune response against the virus, but the vast majority of people do, and then we measure those antibodies. IgM, however, is also an early antibody that will sometimes be positive in people who are actively infected or are just on the end of recovering from their illness, and that one also goes up at about day 7. If you look at LabCorp's test website, for their IgG test, they say that the virus does not mount an IgM response, at least that is detectable by their technology. But we have data that was published in the Journal of Clinical Virology in February of this year, February 24th of this year, by Xuanfang Wang. All right, more Chinese names. But the title of their article is Development and Clinical Application of a Rapid IgM and IgG Combined Antibody Test for SARS-CoV-19 Infection Diagnosis. They call it COVID-2, but it is COVID-19. The reason, by the way, it's COVID-19 is because it was, the outbreak began in 2019. That's why it's COVID-19. In any case, we do believe that there are IgM antibodies. These are the early antibodies. And so when you do a blood test, looking for antibody testing, you're really looking to see if the patient has mounted the immune response. That means their body has seen the virus. And this is important to know for a number of reasons. The next test on the horizon is going to be antigen testing, but we're not there yet. When we get there, you'll be the first to know by watching these videos. Subscribe if you want to get them on an automatic basis. Here's the problem with antibody testing. And there's different ways of doing antibody testing, whether for IgM or IgG. You can do it by drawing blood from a person, which is one of the tests that LabCorp, a large commercial testing company, offers. And the other one is the pinprick test. Diabetics, for example, will prick their finger, put something on a meter, and know what their sugars are. Well, there are point-of-care antibody tests like the ones we use in our office, which are the same thing. It's a pinprick on one of the fingers. We then draw a little blood, and we put it in a cassette, put in some reagent. I've described that test before when we first got it at our office, and there's a video you can watch on that. Well, that technology really hasn't changed. What is the problem with this technology of antibody testing? First of all, the argument that it can give you false positives. There are many coronavirus virus strains out there. They cause the common cold. They cause MERS and SARS, which are previous epidemics of coronavirus infections. So the argument is, well, if the test is positive, you don't really know if it's for COVID-19. The truth is that these antibody tests are really focused on COVID-19. Is there a level of error when you do them? There can be. But I'm in Miami. How many epidemics of SARS and MERS have there been in Miami? Let's see, none, right? How many common cold patients carry coronavirus? Well, quite a few. But I would rather have a test that makes a mistake and tells me that somebody had COVID-19 and then I can investigate further than a test that is missing possible COVID-19 exposures. So for that purpose, the criticism is probably not very good. The other criticism about this test I've already mentioned. Not everybody mounts an antibody response. Almost 100% of people by day 14 of an infection will have an antibody response. But there are some people who don't have an antibody response. Well, again, I can diagnose many of the people, or at least screen for COVID-19 in many people using these types of tests. Now, the other problem is that we need to understand that people who have antibodies may not have active infection. And the other criticism about these tests is, well, even if you have the IgG or IgM antibody, that doesn't mean that you're immune and that you can't catch the disease again. So the presence of these antibodies in other illnesses generally confer immunity. For example, a common one, hepatitis B. If you have hepatitis B or hepatitis A antibody, IgG, you're not going to catch hepatitis B or hepatitis A again. That would be fabulously unusual. So you know the old story, you never say never. So those are some of the criticisms. Then you might want to ask, well, if you have these antibodies, can you pass the virus to somebody else? And we've talked about this also in a previous video. We're not 100% sure. But my expectation is that if you have IgG antibody, almost certainly you are no longer able to transfer this disease to somebody else. You might still carry the virus, and we have reviewed that in a Chinese study of 4 physicians who, after they had no clinical symptoms, after they were cured of their COVID-19, after their IgG antibodies went up, when they measured the polymerase chain reaction, they still had COVID-19 in their nasopharyngeal swab, and none of them infected anybody else. So carrying the virus and the level of infectivity don't always match. So, complaint after complaint after complaint about these tests. Why then do we do them? Well, there's a very good reason that we do them. That it is the best we have right now. So we can't let perfect stand in the way of good. And some of these margins of error and criticisms that I've talked about the test are probably marginal. They're probably minimal. Again, these are areas of study. So how do we do an antibody test? Well, there's a number of ways. You can either drop blood directly, go to a lab, and that is then processed, or you can go to your doctor if they have one of these, what we call point-of-care kits. They prick your finger, and usually within 10 to 15 minutes, we have the results. I don't know what other people charge. We charge about $50 for that test, and that's based on the supplies that we have now and the price that we had to pay for them. Those prices could change, but as of today, April 29, 2020, that's what we charge for a point-of-care antibody test if we have to charge a patient. Let me tell you what's very important about these antibody tests. If you have IgG antibody, it is unlikely that you, A, are going to transfer this virus to anybody else, and we've mentioned that, and I mention it again because I want to drive home the point. But that doesn't mean that you stop using your N95 mask when you're out in public or around a lot of people or anybody who is a high-risk patient. That doesn't mean that you stop using your hand sanitizer, because you could get COVID-19 again on your hands and maybe transfer it to another person or another surface and expose somebody else, especially if it's a high-risk person. Let me again remind our listeners about an opinion piece that was written on The Hill, and you can find this online, by Dr. Scott Atlas, a fellow of the Hoover Institute and the ex-chief of neuroradiology at Stanford University. what we need to be doing more than anything else, especially as our societies and our companies and our businesses begin to open up again, is to create a rigid wall of protection around those patients who are high risk. Those are the ones who are getting serious illness and dying. Are there outliers? Are there young, healthy people, children, tragically even, who die of this virus? Yes, we've seen it. It's been widely documented. It's been widely circulated. But more than 99.2% of the deaths that we see are in people who are in high risk. Who is in high risk? Who are the people that we should especially be protecting? Well, those who are morbidly obese are on the list. If you go to coronavirus.gov and you go and search where are the high-risk groups, morbid obesity is important. How many times on some of our other lifestyle videos and Instagrams have we talked about weight? Oh, let's see, about 3 billion times. People, if this is not a wake-up call for you, if you are significantly overweight or obese, especially if you are morbidly obese, isn't this the time to say, I really need to pay attention to this? Yes, you're going to probably get rid of a lot of blood pressure and cholesterol and diabetes medicines, but beyond that, you're now putting up a wall for yourself against COVID-19 just by losing weight. Well, why would that help? Well, because we know that diabetes, hypertension, heart disease, chronic kidney disease, COPD are the highest risk groups for death and serious illness from COVID-19. Well, who gets diabetes, heart disease, chronic kidney disease? Who gets all these things? People who are overweight in general. I know there are exceptions, but if this is Vegas and I'm going to throw my money down on the wheel, I'm going to bet that that's going to be in patients who are significantly overweight or obese. So that's important. Now, COPD doesn't really track with obesity or being overweight. Sometimes we see people with bad habits, and they have bad habits of smoking and bad habits of eating, and we see both of them, but it's not because obesity causes COPD. It can worsen your COPD because the heavier you are, the more difficult chest expansion and breathing becomes. Of course, it depends on your degree of obesity or overweight. All right, so that's the skinny on antibody testing, the different ways that we can do it, what it doesn't mean, what it does mean, how it might protect you, how it might not protect you, whether you are infectious or not infectious if you have IgG antibodies. And I also test for IgM because I do believe that we do get an antibody spike based on some of the Chinese literature. If you like this video, give us a thumbs up, subscribe so that you don't have to be scrounging around looking for these videos. The information that I provide really is based on data. It's really based on things that are important. By the way, today, on the 29th of April of 2020, we have a proposal by the FDA to accept remdesivir as a treatment for COVID-19, and based on some Stanford studies, about 30% of patients treated with this drug got better. Read the studies. There's still a lot of press coming out about this, but remember, you heard it probably first right here. And you're also going to hear more about vaccines, and you're also going to be hearing more about immunoglobulin treatments that are coming down the line for COVID-19. And at some point, we're going to do a video about opening up because it's coming. Again, thumbs up if you like us, subscribe, check out our Instagram. We're going to look forward to getting your questions, your comments, so that we can address them. We'll see you next time right here. This is Dr. Oscar Hernandez.